It's being called a game changer in colorectal cancer treatment. Testing has revealed a new way to target treatments using biomarkers. Here to explain what that is and what this means to treat this form of cancer is gastrointestinal oncologist Dr. Christopher Liu, also with the Colorectal Cancer Alliance, and then Alyssa Kelly, a colorectal cancer patient. Thank you both for being with us this morning. I'm going to start with you, doctor. Can you explain what biomarkers are and how it's really influencing the treatment?
Thank you, Erin. Yeah, we are moving into what I believe is the most exciting time in the treatment and diagnosis of metastatic colorectal cancer. And, I think in the history of colorectal cancer, it's been a one size fits all, everybody gets chemotherapy type disease. And what biomarkers allow us to do is personalize our therapy for our patients with colorectal cancer. So what are biomarkers? Biomarkers are genes or proteins or anything characteristic of the tumor that makes that tumor unique to that individual. Why is this important? It's important because instead of offering plain old chemotherapy to treat colorectal cancer, providers may have the opportunity to give targeted therapy or even immune-based treatments that are potentially not only more effective to treat colorectal cancer, but more importantly, may have less side effects, which means a better quality of life.
And so if we could ask Alyssa a question here. Alyssa, you're a survivor. Were you able to use this biomarker technology to help in your recovery?
Yeah, so the first treatment of the biomarker didn't work. So then the second, we went to a second treatment of the biomarker, and that worked better than the first one.
And so is this something that X amount of years ago would not have been an option for you?
Yes.
Wow, that's amazing. And so, doctor, talk a little bit about the access that people have to these biomarker treatment and testing.
So one of the most important things is to understand that every single patient has access to biomarker testing. So this is one of the main take-home points. We want every single patient that's been diagnosed with colorectal cancer to simply ask this one question: has my tumor been tested for biomarkers? And then the second question, if it has been tested for biomarkers, how would those test results impact my personalized therapy? And the important thing here is to just have the conversation with your provider about which are the important biomarkers to test for. Number two, to make sure it gets done. And then number three, to have the conversation, okay, well, this is how your biomarker testing may open up additional or more effective treatment options for colorectal cancer.
And really quick, before we wrap it up, doctor, this has saved a lot of lives that perhaps 10 years ago would not have survived this cancer.
Exactly. And so the important thing here is that, as opposed to just one or two drugs that were approved for metastatic colorectal cancer, there are now over 15 approved regimens for metastatic colorectal cancer. For more information, the Colorectal Cancer Alliance has set up a website, colorectalcancer.org/biomarkers. That's colorectalcancer.org/biomarkers, and patients and providers can go to that website for additional information.
Thank you so much, Alyssa. I'm so glad you're doing well, doctor. Really good information. I'm glad you mentioned that website. We put a link to that website on ours, WPBF.com. You can download that, and you can also do it on our WPBF 25 News app. Just search colorectal cancer treatment. Thank you both for being with us. Really good information. Vanessa?